Yo, what's up, Oh my goodness. All right, let's see what we got. Oh no, I turned my Xbox on. That's not what I wanted. That's not what I wanted. Hey. Oh no. Oh man, I'm messing up already. Messing up already. Oh, are people there? Are we here? Oh, that's what I'm talking about. I got 4 people up in here already. That's what I'm talking about, baby. Hey, how y'all doing? How y'all doing? How y'all doing? How y'all doing? How we doing? How we doing? Hey, we had a really good turnout. We had a really good turnout. On Monday, talking about nursing, all that good jazz. I'll give you guys a couple minutes to jump up in here. Give you guys a couple minutes. Couple minutes. How y'all doing? How y'all doing? I got 6 folks up in here. Hopefully y'all stay here and we grow. That's what we do. Y'all go ahead and y'all jump up in here. Hey, how y'all doing? Hey, first time to the live. My name is Kevin. I go by the Boot Nurse on pretty much all social media platforms. I'm a nurse, specifically an RN. And we're here to talk about NCLEX. We're here to talk about nursing stuff. Y'all can ask me anything, whatever y'all got going on. Let me know where you guys are from. Let me know where you guys are at in your nursing journey. You got any questions for me? If you are a nurse, how long you been a nurse, taking the NCLEX, failed the NCLEX, I want to know it all. Y'all tell me. Y'all talk to me. Let me know what's going on. If you don't know, I created a 7-day NCLEX course. I got it going on up here. If you guys want to check that link out, that link is in my bio. It's going for $48 right now, as well as you get that's 80% off of what the normal price is, and you get it for a lifetime. Yeah, I said a lifetime. So if you're a nursing student about to start nursing school in August, and you got to go to school for a whole 2 years, that means you get an NCLEX review that you get to keep forever until it's time for you to take your exam a year or 2 years from now. All right, so. We're here talking about nursing stuff, NCLEX, everything that we got going on. Phlebotomy doesn't count. Maybe. What do you mean? Is it Pooley? Pooley! I'm sorry. I don't know why I did that. What do you mean by phlebotomy? Give me a little bit more context. RN, MSN, 26 years. My daughter will graduate nursing school next May. Shout out to her. Shout out to you. What you got your master's degree in? Tell me about your course. What you want to know about my course? My course is very content heavy. It's in its pre-launch phase right now. And it's going for $48. I specifically made that course because I failed my NCLEX multiple times. And, essentially, you're in nursing school. Those crusty old nurses are telling you that you're never going to be nothing. Nobody wants a nurse that failed their exam, yada, 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 blah, 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 blah. They're full of shit when they talk about that because they're just out of touch, out of time, and just don't realize the true nature of what it means to be a nurse. You don't always have to work bedside, but you can do other things. But I essentially created my course because I don't want nobody to feel like I felt. I don't want them to feel like a failure. I don't want to make them feel like that just because they were unsuccessful at this exam, that they'll be a terrible nurse, because that exam doesn't determine what type of nurse you will be. Only you can do that. The exam just wants to make sure that you're being a safe nurse. That's it. You know that, ma'am. It's 26 years and I know that, right? So, my course is in its pre-launch phase. I'm adding content as we go along, which is why anybody that gets it now gets his 80% off, just like that. So hopefully that answers your question. Pooley, and does that count as nursing or no? I wouldn't say. Phlebotomy is just phlebotomy. Can a nurse do phlebotomy? Absolutely. But mostly for phlebotomists, you're just drawing blood the whole time. But however, if you do have the want and the drive to be a nurse, then ma'am, Pulley, this is where you're supposed to be, and I'm glad that you're here. So I work in the legal dependent in mid-mal claims. Got my master's in forensic nursing with the nice. Okay, there was actually a couple of people in here that said that they wanted to be a forensics nurse. I actually have a couple of friends that actually work in forensics. They're not nurses. One's a deputy coroner, and then I forgot what the other one did. But they do something in regards to forensics. I didn't get all in deep in there because they were telling me stuff, and it was kind of scary, and I just wasn't for it. So law concentration, hey, that's actually really good to be with the law, just for the simple fact is like it. So it's like when people try to play games about thinking that they know the law and their constitutional rights, they don't know nothing. They don't know nothing that's going on. Nothing. Nowadays, you can do a risk management master's. Back then, no, yeah. That's true. Now you can get your master's degree in nursing to do just about anything. Just depends on what school you want to go to. I plan on getting my master's degree right now in education. I did have the full want and desire to go and get my doctorate or get my my doctorate in education, nursing education. But I don't know. I'll get my master's and I'll see how I feel. So there's that. Appreciate it. Was a Nikki D 2013. Ma'am, I really appreciate you being here. And since you are here and you got 26 years of experience of being a nurse, why don't you go ahead and you can go ahead and you can be the moderator for this chat while we hang out here for the next 40 minutes, right? So, yeah, we're talking about nursing. We're talking about NCLEX for all my people that are just joining. Any questions you guys have, as well as where are you in your nursing journey? Are you already a nurse? How long have you been a nurse? Have you taken the NCLEX? Are you in school? Are you in prerequisites? Do you want to be a nurse? Are you confused about what nursing is all about? Are you confused about anything else that, about what's happening right now? I'm really big on the nursing news. I follow so many things that happen within the nursing realm. If you guys didn't know, Rhode Island just became the 41st, I'm about to say the 41st president, but the 41st state to be part of the nursing licensure compact, which means that when you get whoever's from Rhode Island, whatever license you get from your state, which will be your nursing license, you can go to any of the other 40 states and you can work and you don't have to get another license. So that's the great thing about the licensure compact is like once you get your one license, it's recognized in the other states. States like California, Washington, Oregon, and a handful of other states, they don't do it. At some point, everybody will follow suit, which is, in my opinion, they should all be doing anyway. But hey, who am I? I'm just some guy, some rando on TikTok. I'm looking at what resources my daughter has for her NCLEX next summer. Hey, I got one right here. My course will be all the way done by next summer. And there's plenty of things that I'm going to be adding. This is just an ongoing thing. I'm all about building an empire. And I will take anyone who wants to go with me. So this is definitely one of those ones where, I put the content out. I bring relevant people to come and talk and teach and all that good jazz. Working on getting NCLEX style questions. Looking at the new generation NCLEX. Actually, I don't even know why we will call it new generation since it's now the current generation. Current generation NCLEX. The NCLEX, whatever. So working on all those things. We're a work in progress. Hey, but we're going to get there and we're not stopping right here. So Bianca, do I need to know every little random disease and how I can tackle them on NCLEX? That's kind of a very broad question. It's more about understanding the disease processes. Some things you do have to memorize, but you do have to familiarize yourself with the disease processes. And here's the funny part is that a lot of the disease processes that they'll ask you on NCLEX, they all relatively have like the same signs and symptoms. Like people that have cardiac issues relatively all have the same signs and symptoms of whatever they have going on. Same thing with the family of medications. So it can definitely be a challenge for sure. But yes, you do have to know them. Archer Review is exactly the format of the NCLEX. Yes, it is. I have seen and used Archer. Archer's that way. UWorld is now that way. Kaplan is now that way. Trust me, I've seen them. I actually recommend people to use Archer's test bank. And the only reason I recommend that is because I don't have my own yet. But once I have my own, that's going to be a different story. Not necessarily, but you need to have the understanding of the disease process and care. Yeah, absolutely. Nikki is very, very much correct. Pathophysiology actually was one of my favorite classes because that's all it is. It talks about the disease processes and how it affects the body and how it affects you. And it's great. Now, when it comes to pharmacology, that was a monster. Like the class pharmacology was a monster. And then when you get into nursing school and you're applying the pharmacology to the disease process and, what are the expected and unexpected outcomes, that's when you start to kind of have a problem. So you're just like, whoa, what does that do? But I feel like once you understand pharmacology, it's just like, because that's, to me personally, one of the hardest sections on the NCLEX exam is pharmacology. because it's so many drugs and then so many side effects and what the signs and symptoms are. The toxicity levels, all that good stuff. So I had to take pharmacology twice in undergrad. It's a monster, right? It's crazy. The new generation NCLEX is really random. I'd advise anyone studying to not memorize specific diseases. I would agree. It's really about understanding the questions and knowing basic pharm. I also agree. When it comes to pharmacology, if you know family name and suffixes, and if you know what the signs and symptoms are, like I said, almost all cardiac meds, they're all relatively the same. Like for the signs and symptoms. So if I give my prills, or if I give my LOLs, my LOLs are a beta blocker. Okay, what do beta blockers do? What about furosemide? Like, what does that do? Okay, cool, it lowers blood pressure, right? Okay, but what do I have to know before I give furosemide? Like, what's their blood pressure like? When do I hold the medication? When do I call the doctor? What do I look out for in regards to safety? In regards to furosemide, what does it do to the body? What does it deplete? What do I have to replenish? They're looking like they're having a wide QR complex. Why? Why are they having a wide QR complex when you just gave them furosemide? You see what I'm saying? It's just things like that. Everything has a trend. So if I give you, you guys ever heard of like too much of a good thing can be a bad thing, right? So when you hear those things, you're just like, furosemide does this. But if I give too much, it's going to do this. So now I got to follow it. And then we start talking about lab values. Okay, why is their potassium too high? Okay, what is their EKG going to look like when their potassium's too high? What is their EKG going to look like if it's too low? What if their pH is too low? What does metabolic acidosis look like? Stuff like that. When I took the NCLEX, it was the first year. They were making it computerized. I'm a fossil. Ma'am, I'm going to need for you to just not do that. Don't do that. You ain't a fossil out here. Don't play these games, okay? But you was the first to take it, so I appreciate you for being a guinea pig for that. Hey, now it's the standard, so no one else in here knows what it's like to take it on paper. One of my mentors, she took her NCLEX on paper, and she had to wait 8 weeks or something like that for her to get her results in the mail. I was like, man, you poor thing. And we cry about waiting for 2 days. Some people actually get theirs instantly. So I would have loved to have an inexpensive course to take. So thank you for making this available for people. Absolutely. ATI Comprehensive was not helpful at all. You're not the only person that said that. I personally never used ATI. I actually did a webinar last year or the year before with a girl. Her name was Kristen, and she will swear by ATI. But she was one of those girls who was like super organized. And she would go through it. And look, when I tell you my girl was regimented, she was regimented. So she loves ATI. I have a couple other people that like ATI as well. Like I said, I never used it. I used HESI, did not like HESI. To me, the questions were confused or confusing. I debated and I fought so many questions. But at the end of the day, nursing schools have some of these things that they have, they're a racket, and they make it, mandatory. And I'm glad things are actually going in a different direction. And so I've actually taken, I try to take, the new generation NCLEX, practice questions. I try to do those like every other week or at least like once a month, just so I can stay up. They're not really going to change like in a month, but, just try to keep it up just to make sure, because I'm not perfect. I don't get them all right, but I know that I'm not going to fail the exam. Not going to fail it. So, but I like going through it is because I like to keep myself up to date. So when I'm coaching or when I'm teaching, it still remains relevant. Right. So, a lot of people don't agree with me, but I actually like the case studies, because the case studies give you everything. They give you everything about the patient. Patient comes in at this time. They're this age. They have these comorbidities. They're displaying these signs and symptoms. What is the very first thing that you do? Oh, okay. What do I do? Right. Anaya, good to know. I will tell my daughter. Yeah. I used Lippincott Prep. It was really good back in the day. Is it still around? It's funny you say that. I actually have. See this thing? See if it sees. There we go. See that? You see this massive thing? This behemoth of a book? Look at that. Look at this. Look at this. Some cat drinking milk out the bowl. Look at this. Ridiculous. So one of my mentors gave me this book. Ma'am, Nikki, look, ain't no way. Ain't no way. There's no way. I would have fallen asleep trying to go through that book. So I'm just saying, that book was great back in the day. Now, it all just depends on you. Honestly, it just depends on what type of how you study. Like, it's just like, how do you study? Like, are you a book person? Are you a computer person? I like to try to tell people nowadays, do your practice stuff on the computer because your test is on the computer. To me, that only makes sense. But hey, it may not be for everybody. So it was a few chapters a night. I don't know how you got through a few chapters and not falling asleep. I get through 2 pages and I'm just asleep. Don't know how it happens, but I'm asleep. That's a no-go for me, ma'am. No-go. Case studies are good because it makes you apply your knowledge. 100%. Yeah, so it's just like with those questions, it's just like, hey, you have a nurse that's getting report from the offgoing nurse in the ER. Which patient do you see first? Now, granted, they're still going to have those questions, but it's going to be more towards like, now they have extended multiple choice where they give you a little bit more answers and they give you a little bit more data. But the case study is like, they give you everything. They give you the complete representation of what a patient is like, what a patient presents to you, but on paper. I'm pretty sure one day the NCLEX is just going to be straight, just hands-on. And then it's just going to be like hands-on, and then you're going to have a proctor. Hopefully it won't be like some AI generated thing that's just going to be like, you fail or whatever, you know? So, but yeah, I've taken the NCLEX RN twice and yet to receive my report from both times. Leo Guzman. Sir, what I would suggest that you would do is that you would, if you have taken the NCLEX twice and you haven't gotten a breakdown, your breakdown is going to come from your state's Board of Nursing. So I would call your state Board of Nursing and be like, hey, I don't know my results. Can I have my breakdowns? And then they'll either mail them to you or email them to you, one of the two. And I'm telling you that because I have 3 of them. And if anybody's seen any of the videos that I've had, either on YouTube or even if you go to my website, if you go to the 7-day NCLEX course, which is linked in my bio, and if you look at that video, I talk about how I failed it 3 times. And all 3 of my breakdowns are right there. Nurse Nelly. Hey, shout out to Nurse Nelly. Hey, she's a long-term friend. She's a caseworker now. And y'all go over there and follow her right now. I want 19 people to show up on her friends list right now. Go over there right now. I used to do 30 minutes of adaptive quizzing at a time. Otherwise, would have felt like a waste. So some people can do 30 minutes. I usually don't recommend doing 30 minutes. I say if you're going to do an adaptive quiz, do it for whatever the minimum amount that the NCLEX is going to provide you. So as of right now, or not right now, but as of now, the NCLEX is 85 questions minimum and 150 questions max. 70 to 150. I'm sorry, 70 to 135. Am I not mathing right? Yeah, 135 are going to be 15 of those are going to be research questions to improve the NCLEX. So I would recommend doing whatever the minimum to pass is. That's the bare minimum of questions that you should do. So if you can do 85 questions in 30 minutes, cool. Just saying. I want to give yourself a little bit more time. Not everybody's you, Nelly. Okay. As a former ER nurse, I thought you was about to hate on us. So here's the thing. I can't hate on ER nurses. So I was an EMT long time ago, like 2008 to 2010. I did it for like 2 years. And I worked in the ER as a tech, and I loved it. So I would never hate on an ER nurse. There's not really a lot of nurses that I would hate on. And so for those that don't know, is like I've been a nurse for 3 years. I've worked in the ICU, 3 ICUs. I worked in a burn ICU, a medical, and a neuro ICU. I worked in the PACU, and I worked in the operating room. And that's only as a nurse. Like as a corpsman, or if you want to call it a medic, don't ever call me a medic, but I'm a corpsman in the Navy as well. And I've worked in a lot of different departments. So I can't hate on the ER because I used to work there. I'm just saying. The problem with the case studies is that they aren't based on anything you really do. I don't know. I don't know. Is that doll face? I don't know. That's up for debate because some of them are actually really really good. Never. We love our ER nurses. Hey, for real, shout out to the ER nurses. But I can tell you one thing: as an ER nurse, I don't like shit shows being brought up to me. However, there's nothing I can do to change that. There's nothing I can do about getting shit shows showing up to the ER or to the ICU. Because ICU, we bougie. We want everything. We want our central lines. We want them all cleaned up. We want them all nice and pretty. In the ER, it is controlled chaos. That's the one I like. Tag them and then get them away. I'm all about it. So, any recommendations for I'm scheduled on the 27th of July? Nia, what do you mean? Recommendations for what? What is better, Archer or Simple Nursing? I just failed the NCLEX. Well, Valentina. Number one, I'm going to tell you it's unfortunate that you were unsuccessful at your exam. That's number one. Number two, it all just depends on you, how you learn. Number three, Archer is cheaper. But I like Simple Nursing's, not Facebook, but their YouTube. I think it was very, very informative, especially his pharmacology. I like Nurse Mike. I like Archer. I don't shit on other reviews like that. However, I do have my own review that's in pre-launch right now. Go ahead and check it out in the bio. But I actually like them both. I think Archer's NCLEX style questions are pretty good. And Simple Nursing, his videos are very informative. I've seen some of the questions, and they're okay as well. So, but one thing I'm going to tell you, Valentina, is you're not a failure. Doesn't matter what you have going on. We all are unsuccessful. I failed mine 3 times. I don't know if you're new here. And if you're new here, you better follow me. And I better see at least 1,000 likes up here. Hey, y'all need to smash that like button right now. Do it. But it's okay. It's okay that you didn't do well, right? Because you're gonna do well and you're gonna learn from this. So one thing I'll say is go get your breakdown and see what you didn't do well at, and then improve upon from there. If you're hurting in the pockets, I think that Archer will be okay. $89, I think, for like 3 months or something like that. So I definitely would check that out. But it all depends on you. But I think they're both okay. I had narcolepsy in nursing school. I'm lucky I stayed awake long enough for 30 minutes. Look, I don't even know how half the time I made it through nursing school. And nursing school made me addicted to coffee, and I'm not, and I don't like that at all. Having a hard time to study because I've been passing my adaptive exams, but can't seem to pass the NCLEX. Both times have been getting a lot of questions regarding maternity, and that's what I'm weak at. Okay, if you've been getting, so you literally just told me what you need to work on right there. It's like maternity, maternal newborn, pediatrics. If that's your weak spot, that's where you need to restart your studying. So for me, when I failed my NCLEX the 3rd time, I knew for a fact pharmacology, maternity, and peds, or whatever, those were my hard spots. So when I started studying, that's where I started, right there, pharmacology. And as soon as I got done with pharm, I went straight to maternal newborn. So if those are your weak areas, start there first. You just told me the answer. I had 150 questions on my NCLEX, and I was sick. This was the first year it was on the computers. Look, let me tell you. I had 150 questions and failed last week. And so here's the thing is I would rather fail at 150 questions than fail at 75. Because the longer that you go in the exam, the more chances that means that the exam cannot determine whether you're doing well, but you're not doing so well. So it's giving you more chances for you to pass versus when you get to 85, it's either you did really well or you did really bad. Newsflash, I didn't do so well the first time. And in the first exam, I got 75 questions. Bombed that shit. Second time, 265 questions. No one who has gone to become a nurse from when COVID started will know anything about that. That 265 was no joke. Like, I'm telling you, my vision got like this. I was sweating. I'm black as shit. So I got really pale. Man, I probably shouldn't have said that. It don't matter. Hey, smash that like button. I want 1,000 likes. 1,000 likes for that comment alone. But I get it. I get it. You had 150 questions and you failed, right? So now this is not time for a pity party. Valentina, not a time for a pity party. I don't coddle people. So one thing I'll tell you is that you failed last week. Cool. What's that breakdown look like? Oh, it says below here. Okay, cool. What are we going to do about it? On your breakdown, it will tell you, hey, you didn't do well in management of care. It was below. In management of care, it even tells you the subcategories that are in management of care, like delegation and supervision. Who do you see first? Staff management, stable versus unstable, stuff like that. You see what I'm saying? So you utilize what is given to you, because that right there will tell you where you need to improve on. Was in the ER. I'm just happy if they have, right? Better make sure you get those lines. Yep. Breathe, study, take it again. I will check yours out. Okay, awesome. My husband was deployed and I have kids, so I had a hard time studying that. So that's what we call an environmental factor. And it is very much true, and it's very much a real thing. You having kids, Valentina, 100% understand it. So this is where it comes to, like, man, what does my support system look like? Do I have anybody to watch my kids? Do I study when my kids go to sleep? So it's just, there's always a way. Remember, and I don't want you guys to think this sounds cliche, but we all have the same 24 hours in a day. However we decide to utilize them is just the way that we do it, right? So where there is a will, there is a way. I do know a specific individual that used to work at Walmart and would study during her break time. I'm just saying, I ain't gonna say no names. Trust me, the hospital doesn't care how many times you. Nikki, tell him again. I apologize. Any recommendations? I am scheduled for my NCLEX on the 27th of July. Nia, I'm assuming you mean like NCLEX reviews. Well, the one thing I will say is I got one, but it's not anywhere near close to what you're going to need because it's not complete yet. So the ones I would suggest, if you're looking for YouTube channels, Simple Nursing is a good one. Archer, their YouTube is good. Picmonix is good. What else is good out there? Archer, like as of right now, today's the 12th, and you're taking yours on the 27th. So my recommendations for you would, I hope that you're on a schedule. Follow your schedule. Give yourself breaks. Hold yourself accountable for what you are doing and not doing. Time management is key. Make sure you're studying your content. Make sure you're reading, you're reviewing your questions after you take your quiz. I like to say a rule of thumb, you shouldn't take any longer than 2 minutes to answer a question. I like to say on average, you shouldn't take more than 90 seconds to answer a question, because 90 seconds puts you right at an hour, between an hour 15 and an hour and a half in regards to getting the 75 questions. So, I mean, if you give yourself an hour and a half to hour 45, that'll put you right at 85 questions. And remember, you get 5 hours to take this exam. 5. Follow, Valentina. I was a single mom and I had 3 kids. Now she has 4 kids. When I was going through nurse school and NCLEX, I'm here for advice, tips. Yep. After taking it a few times, does it focus on your weak subjects when you can go and retest? Hold on one second. All right, right out of the archives. Boom. This right here is one of my breakdowns. This is my very first NCLEX failure right here. And I'm going to tell you how many spots it says below. You hear me, Leo? Check this out. Management of care, it says below the passing standard. Why? Because I was stupid, right? Safety and infection control, below the standard. Health promotions and maintenance, below the standard. Psychosocial integrity, below the standard. Basic care and comfort, above the standard. So I did well there. But that's only 6 to 12% of the exam. Pharmacology, below the standard. And then reduction in risk and physiological adaptation were near. So I had 1, 2, 3, 4, 5 below. And I ain't talking about the store, right? 5 below. You guys can see it. Put my face in here because I know it's being weird. Right, so right here. You see what I'm saying? And then when it tells you below, it gives you tells you what's in the breakdown. Like management of care, it tells you right here. What is management of care? Providing and directing nursing care that enhances the care delivery setting to protect clients and healthcare personnel. Talks about advanced directive, advocacy, assignment, delegation and supervision, case management, client rights, collaboration with an interdisciplinary team, concept of management, continuity of care, ethics, informed consent, legal rights, quality improvement. Stuff like it tells you right here. Right? And I like to be very transparent about that. Some people are very ashamed and very afraid to tell people that they failed. Not me. I've had people tell me to my face, "Oh, you failed that exam. I would never want you to be my nurse." I'm just, cool. Ain't no skin off my back. It don't change the way that I feel about myself. It damn sure don't change my paycheck. And you definitely aren't going to deter me from knowing who I am and knowing my truth. All right. So after taking it a few times, does it focus on your weaker? No. So when you take your exam, you're going to get so the exam is tailored off of you. You're not going to get the same exam. Like if your last exam, if you were weak in pharmacology, when you go to take the next exam, if you're still weak at pharmacology, it's going to exploit that. You see what I'm saying? So every test is different and everybody gets a different test. And it's all randomized. That's why it's called a computer adaptive, is because it adapts based off of how you answer. Okay. I was blessed to pass the first time, but I promise I have never been interviewed about the NCLEX. Yep. They don't ask you about that. When that lady asked me, "Hey, is this you?" And I was like, "Yep." And she's like, "Okay, good. I'm glad I got the right person." That was it. She wasn't like, "Ew, Kevin, you took the exam 3 times. Oh no, you can't work here." I wish a job would. Ain't nobody stupid enough to do that. Hi, I'm new here. What did you do to help you with critical thinking? What I did, honestly, and this is probably not gonna help you. Oh no. Let me back up. So my critical thinking really, really hit me hardcore when I started working in an ICU. Now, when I was studying for NCLEX, it was more of going through the material over and over and over and over and over, building that repetition, getting a system down. And you weren't here earlier, Tony, but when you understand the disease process and how everything has a trend or everything has an effect, or I like to call it like the spiderweb effect. So if you have like this issue that's happening here in the middle, it's going to branch out. So it's like, this could happen, this could happen, this could happen, right? So like, okay, like what is the disease process? Or if we're talking about medications, I'll go back to that example. Let's say I have somebody with congestive heart failure. Okay, cool. Somebody that's coming in with congestive heart failure, what are they going to look like? What are they going to sound like? What signs and symptoms are they going to have? Are they going to have peripheral edema? Are they going to have crackling, like when you're listening to their lung sounds? Could they have a pink frothy sputum, right? Okay, cool. Now I know that they have this. Now that's telling me that they have an ejection problem, the heart ejection problem, and they're retaining fluid. What am I going to do with that fluid? I got to get it off the body. So what am I going to give them? I can give them a K-wasting diuretic, a loop sparing, or a loop diuretic. I can give them anything like that, right? But then I was like, okay, let's say I gave them a K-wasting, right? A K-wasting diuretic like furosemide or Bumex or furosemide, whatever. That's going to take all of the fluids off of them. But what do I watch for when I give them that medication? Or what do I check for before I give them that medication? Do I check their heart rate? Do I check their vital signs? Right. And then once I pump all this fluid out of them, what else am I going to check them for? Oh, am I going to be looking at their EKG? Because what does a K-wasting diuretic do? It wastes your K, which is your potassium. Okay, now am I going to have a wide QR complex, or am I going to have a narrow QR complex because I have low potassium? Am I going to have to replace the potassium? So that's where your critical thinking comes from. Okay, what is the safety going to look like? Am I going to want this person to bounce up, right? Do I want to give them a Foley? Do I want to give them a bedside a urinal? Are they strong enough to walk? Are we looking for orthostatic hypotension? Are we looking for level of conscious change? There's a lot of things. So you kind of have to understand the disease process. And then once you understand the disease process, you understand the trends of how it goes. I really hope that made sense. I feel like I started kind of talking in circles, but once you start to understand, it's just like none of that news is different, right? I'm a CNA and an EMT. I want to go to nursing school, but I'm 56. I think I'm too old. Girl, stop. I'm 56 and I'm too old. Hey, yeah, Nikki, handle that, please. Handle that. Girl, bye. Not at all. Do it. That's what I'm talking about. My daughter's in nursing school, and some of her classmates are. I had like one lady who was in school with me who was she was 51. Another lady, she was an LPN or an LVN for like 20 years, and she was like 48. Like we had a lot of people that were older than me. I went to nursing school when I was 31, and I graduated when I was 30, before I turned 33. And this year I turned 36. So, wow, that's the first time I ever told anybody my age. I'm going to make sure not to save this so no one can be like, how old are you? Oh, my God. Yeah, that's what's helping little by little. And the thing about it, Tony, is that it's only going to be little by little. You're not going to learn it. You're not going to learn it. You're not going to learn it overnight. It takes practice, and it takes practice and practice. And when you pass NCLEX, trust me, that is only the beginning. You get up one mountain and you get that peak and you're just like, yeah. And then next thing you know, you're at the base of another just massive mountain that is just endless. All right. So that part, I didn't have critical thinking before ICU. That's true. And so like you get your critical, I'm telling you, like you hone in on those critical thinking skills so much when you get on the floor, especially if you get into a critical care area like the ER or the ICU. Let's see. I just took the NCLEX and I failed. I was below safety and infection. Take action. Are you telling me to take action, or are you telling everybody else to take action, Alyssa? I mean, because I'll take it again. Ma'am, I'm not taking that exam again. I'm here for y'all. Ma'am, you're old. Don't talk about me like that. It's rude. But yeah. So shout out to everybody that's in the live right now. I appreciate you guys being here. If you guys have never been here before, my name is Kevin. I go by the Boot Nurse on every social media platform. I have an NCLEX course right now. If you guys go to my link in my bio, it's 80% off. It's for $40 and you get it for a lifetime. We're constantly updating stuff and putting new lectures in there. The next set of lectures that are going to go in there we're going to be talking about computer adaptive testing. We're going to be talking about the passing standards. We're going to talk about the NCLEX test plan that the NCSBN just dropped in April of this year. We're also going to talk about how to answer NCLEX style questions and even the rules. Like, there's actually little rules to think about. Like one rule, don't pass the buck. Pretty sure y'all heard that, right? So, yeah, so definitely a work in progress. It's going to be here. It's going to be here for a while. So, anybody that needs that, or if they're going to be starting nursing school and they want to have an NCLEX review for $48 by the time they graduate and study for NCLEX, hey, it'll be there for you, baby. One thing, and I don't know if anybody ever heard about this, but does anybody know? We're going to talk. So somebody said something about safety. Yeah, Alyssa said something about safety, right? So speaking of safety, no, that's the other section they have that said I was below. Okay, so let's talk about safety. We're going to talk about safety for a few minutes before I get off here because, your boy got other things going on, but I love being here for y'all. So does anybody know who Redonda Vaught is? If you know who Redonda Vaught is, smash the like button like a million times. And I'll wait to see who she is. Because if you guys don't know, like Redonda Vaught was a nurse. She worked at Vanderbilt University, and she essentially was the woman who got her medications mixed up. She ended up giving a 75-year-old patient who was going down for an MRI or a CT scan, she ended up giving them vecuronium. And this is what, speaking of pharmacology, this is where pharmacology plays so much when it comes to safety, right? She gave the wrong medication. She gave a paralytic or a muscle relaxer. It's not a muscle relaxer, it's a paralytic. But she gave a paralytic medication to a 75-year-old woman and didn't read it, and that lady died. And nobody heard about it. Nobody really heard about it. That's a huge safety issue. There were a lot. She overrid the Pyxis, and the Pyxis is the medication dispensing machine that gives you medication. And she got it confused with Versed. Now, here's the thing about the medication dispensers is that vecuronium is a paralytic, and it gives you so many warnings before you even pull it. And vecuronium has to be reconstituted. It comes in a powder, like in a powder form, has a yellow piece of tape on it. It says warning, it says paralyzing agent. That's what it says on it. It's like holding like a bomb in your hand. And that's not going to explode, but you're just like, whoa, I got to be careful with this. So when you have patients that are on vents and they're fighting the vent, and if you give them vecuronium is one that's actually it's a good paralytic to give them, obviously in microdoses to prevent them from fighting the vent, right? And there's other medication that they can use that for they can use as well. But anyways, she gave vecuronium instead of Versed, which is medication's name is midazolam, right? And if you guys know about midazolam, you guys should know about that in pharmacology. Harmon, hey, how are you? Thank you for showing up for the live. So, long story short, she gave the wrong person the medication and they suffocated and died. She, of course, got in trouble for it. She got fired and then she lost her license. And then 2 years after that, they retried her for murder. And she got 10 years. She got sentenced to 10 years in prison, right? And here's the thing. It was before COVID. They were the hospital was massively understaffed. There was a lot of things that they were doing wrong. But granted, there's no room for that. Like if there's one thing that you need to be very particular about when it comes to working as a nurse is that you need to know your medications. You need to know which ones look alike. It happened in did it happen in Nashville? It was in Vanderbilt. Is Vanderbilt in Nashville? I don't know my geography like that. I'm a little slow. Like I don't know geography and I don't math well. So somebody let me know. But yeah, that's what happened. And she got sentenced. Now here's the thing I agree with. She lost her license and she doesn't deserve it back. What I didn't agree with was for the fact how she was punished. And then when people found out that the hospital swept it under the rug and they paid the family, then the hospital was like, oh, it's not our bad. It was her bad. So then they brought her back and they tried her. And then she got sentenced. That, what I didn't agree with is because these hospitals make billions of dollars all the time. And she's a martyr at this point. Like she's an example. And essentially it's just like, it made nurses afraid to be able to speak up, right? It made nurses afraid to be able to speak up because one of the things we always say is just like, we want to speak up about the mistakes that we make so we can improve upon them. That's what quality improvement is. But now nurses were afraid to do that. That's a huge mistake. That's huge. Like leaving the bed rails down, or one bed rail down, or if a patient is restrained and they try to jump out and, look like Tom Cruise off the first Mission Impossible, you got to write an incident report for that in order to make things better. That actually happened to me when I was in ICU. I wasn't there. He just decided to do what he wanted. No bed alarms, stuff like that. Those are things that can be improved. That you cannot come back from, right? But the reason why I bring this story up about safety, that is what the NCLEX wants, is for you to be a safe nurse, right? But a story came up about her, yesterday or the day before, and it says former nurse sentenced for dosing error seeks license return. I don't know about y'all, but there are just some things you can't come back from. It's just like, I murdered them, but it was completely by accident. Ma'am, no, that ain't it. You know what I mean? So this is why I say that when you study for your NCLEX and you know your pharmacology and you know everything essentially that's going on, is that you're learning the basics of the basics, right? You're learning the basics of the basics in regards to nursing safety. Nurse Terry, you disagree with what? What are we disagreeing on? You got to give me more context before you come up in here and start disagreeing. As a patient, I would be safe harbor from that nurse. Absolutely. So in the state of Texas, if you guys are not in Texas, safe harbor is essentially something that you can invoke when there's unsafe patient-nurse ratios. Because there'll be certain times you can be put in situations where they'll be like, hey, I need for you to take this patient. You'll be like, dude, I already have like 4 or 5 patients that are critical. I'm doing safe harbor because if something happens to those patients while they're under your care, and if they pass away, and you're just like, look, I have a patient that's over here, one that's all the way down the hallway, that's this, that's that. Safe harbor is essentially saying like, look, I told them not to give them to me. This is what happened, and you will be as detailed as possible. So essentially it's CYA, cover your ass, right? So that's essentially what safe harbor is. Because unsafe patient-nurse ratios are very real. There's actually one that just recently changed, I think, in New York, where they were doing 2 nurses to 1. Boy, oh boy, let me tell you how glorious that would be. Not just ratios, but unsafe environments, like a 4-day post-ROSC and what? That person probably a vegetable. Anyways, so essentially anything that's unsafe in regards to essentially the nursing practice. I feel like she should be able to be considered for reinstatement. How so? And this is a good argument. Like, this is a good argument. However, I worked in the ICU, and shout out to everybody else that works in the ICU. I work in the OR now. OR nurses don't fuck with vecuronium. Like, we give Versed, but they don't mess with Vec. But the ICU nurses do. And another thing that really bothered me was for the fact that I think she worked on a med-surg unit. So what in the world is med-surg? What in the world is vecuronium doing on a med-surg unit? Like, usually medication dispensers are acuity dependent, or acuity. They're based off of the acuity. So why in the world would vecuronium be in a med-surg unit? That's something else that I didn't understand. I was asking all the same questions that we were all asking. So, in regards to the actions of what she did, I personally don't agree, because it's just like, oh, I gave vecuronium instead of Versed. Yeah, but on the Pyxis it says midazolam as first, not Versed. And vecuronium gives you so many warnings before you can even pull it. So, but that's just my experience. The issues that were going on at this hospital, where there was a lot of overrides for everything, they put unnecessary things inside the Pyxis. I think like normal saline. Now, I mean, I'm not trying to fucking bolus and fluid volume overload nobody. Not saying that they can't die from that, but it's just stuff like that. Let's see what we're talking about right now. Terry, I agree, and not able to deal with controlled meds anywhere. Yeah. I can't make this stuff up. Oh, yeah, you're right. She was at the ER Pyxis because patient was down from yeah, that's right. Okay. It truly is much bigger than just that, than the individual at the end of the day. Just my thoughts. No, I don't disagree with you. That's what I'm saying. That there was a lot of issues. In the article that I had read, I didn't even know she had went down to the ER, because the first article I had read said it was at MedSurg. And this is another reason why I wait for things. I wait a little bit longer for things to come out, just so the facts and the stories can be straight. And at my ER, you can pull any medication because you don't have, to the patient's chart. Okay. I've seen a lot in 26 years. Yeah. Wow, I hear you. I also work in a level 1 ICU. I feel like there were too many issues with overriding, etc. I don't disagree with you. Like, especially when there's a code that's happening, it's like as soon as that code blue button comes on, it's just like everybody and their mom is starting to pull stuff. Like, one time I went in there and they were just like, "Hey, we need the fentanyl, we need this, and we need that," and then it's fucking chaotic. It is chaotic. And the next, people are coming around at the end of the day. "Hey, did you pull this?" "Yeah, I pulled it because we needed it." And then I got a director or somebody coming to yell at me, and I'm just like, "Hey, look, I got it right here. Let's get this counting going on, because I still got to take care of this patient." Right? And with Terry, with you working with the ICU, and I'm pretty sure for a bunch of us nurses that have been working, is like, I'm pretty sure we got some horror stories, right? Not to try to scare anybody, because we talk about NCLEX, but we talk about nursing. And this is the things that people that want to become nurses, this is the reality that you guys are going to be walking into. Yep, I had 3 nurses walk in with bicarb at my first, right? They're like, "Bro, where'd y'all come with that?" "Oh, I wish it was just in my pocket." Everybody walking around with fucking bicarb, right? "I got some epi if you want some." Hold up. Why are you just hanging around with epi? You know what I'm saying? Like, I don't get it. I've done my fair share of codes, especially on nights, because my ICU life was nights, except when I was at the burn ICU. Then I worked on days, but it's wild. It's wild out there. And I worked in the ICU during the second wave of COVID. So there was a lot going on. So, it's a part of the cycle. Me and Epi are besties. Hey, shout out to Epi. Not me saying like, "Hey, do we got a pulse?" And I'm just like, "Oh, yeah, we do." And I'm just like, "Wait a minute. Oh, it's going away. Oh, hell." And then the doctor's like, "Seems like the Epi's wearing off. All right, let's do it again." I'm not laughing for the fact that we're doing codes, because, I mean, after a while, a code is a code, and it is what it is. And, we respect everybody as things go on. But it's just really wild to me, just like when you're doing a code and how quiet it is. And then they start talking to you and they're like, "What do you think about this?" And I'm just like, feels good to me. there's one thing I can say about a code. From most of the codes that I've been in, it's like they've been very they're very what's the word I'm looking for? Um, the teamwork is great for all the codes that I've been in. In nursing, you have to have a very dark sense of humor. Speak for yourself. No, you're right. Just last night, I pushed atropine 4 times on a bradycardia patient, and I never pulled one. Look at that. Look at that. Hey, not me seeing like just a slow heart rate from a lady when I was in the ICU, and then next you know she's like in the 70s, and then beep beep beep, and I'm just like, she in the 40s? Oh no, she's in. And then the husband was in there, and the husband was in there, and he was talking to me, and he was talking to her. You know, she wasn't all there, and then next thing you know, I look outside, and I'm like, hey, can you give me some atropine? And he's just like, nah, and I'm just like, no, hey, can I get some atropine? He's like, yeah, I got you. Why he's getting me atropine? Code. I'm like, why me? And it was wild. It was wild to do a code in front of her husband. Like, and that's the crazy part and stuff that we have to deal with. So, Terry, I want to work there. I want to work there. And jealous of the teamwork. Right, teamwork is pretty great. Pre-21st century. Wow. Okay, you really had to go there, but whatever. Pre-21st century, it was a bit wild, wild west, but those were good times. Depending on the hospital that you go to, you and I both know it's still the wild, wild west. In the wild, wild west. So, you know, that's just how it goes, man. It's just like, this is another thing that I like about doing these TikTok lives. Besides the fact that if anybody needs a 7-day NCLEX course, the link is in my bio. See what I did there? But no, I like these sessions because we can vent, we can sit here, we can talk about it, we can guide each other, we can essentially change the narrative of you know, like what nursing is really like, and what the, you know, boot nurses, because that's what I call everybody. I have a military background, so everybody that's brand new to anything is a boot. I've been a nurse for 3 years. I'm a boot. I don't know nothing about nothing. I'm learning every day. You know, Nikki's been a nurse for 26 years. Guarantee she don't know everything about nursing. So she's learning every day. I'm not going to call you a boot because I feel like that's just kind of rude, and I don't want to do that to you. But I do like these. I like these conversations, and I like to talk back and forth to you guys, and you know, I enjoy this. So the banter is really good, and it actually draws a really good conversation. But if you guys get the chance, go look her up, Redonda Vaught. She has for the last probably 2 years, I think. Definitely the talk of the town in regards to how things need to be done differently for nurses in the nursing field. 16 years for me and still don't know anything. Hey, that's okay. I feel like I am past. You're what? I feel like I am pants at this point. I don't know what that means. What does that mean? Like you wear pants? I hope so. We all got to wear pants, man. I'm just saying. But yeah, I appreciate everybody stopping by. I'm probably going to hang out here for probably about maybe another 20 minutes. I was going to get off 10 minutes ago, but man, y'all are out here doing your thing. So, you know, we'll keep talking. There's some other stuff that came out too. We were talking about different nursing jobs at one point, and there's one lady that I follow specifically. Her name is Kelsey, and she runs this website called Whole Life Nursing, and she is all about doing other things differently outside of the traditional bedside nursing. Boot and pants, then shirt. Okay, I got you. Boot and pants and shirt, I got you. Not the bottom of the barrel like boot. Wow, okay. Y'all have a good night. Keep doing your thing. I appreciate it. Thanks for stopping by, Terry. So yeah, she has different types of jobs that she talks about and different non-traditional nursing jobs. So, you know, it's stuff like that. So happy I'm I'm a NICU nurse. Hey, shout out to you. Hey, you never know. There was somebody in here in my last live on Monday that's all they wanted to do. I think NICU and labor and delivery. I remember I did my rotation in the NICU, and I don't know. I was kind of sad being in there because I saw how the babies were, and I was like, I don't know if I want to do that. So, but I started to get a real big I started turning into a softie at that point. Oh, this is what my daughter wants. Hey, she can get there. But NICU nurses, you guys are a special breed dealing with NICU babies for sure. You guys really, really are. Um, Kids was never my right. I thought critical care was my was my area. That's all I talked about for years, is that I wanted to do critical care, and I worked in critical care. I wanted to go be a CRNA, and when I worked in the ICU, it was just like there was a lot of things that were going on in my life at that point. And then I think me going into the ICU during COVID, and then the lack of support, the unsafe patient nurse ratios, the unsafe practices that were happening at this hospital, and then working on nights. That was just pretty much the. There was already a whole bunch of other stuff going, but that was just the tip at that point. I was like, you know what, I'm done. But then I realized that I really love to teach. I really love education, and like I said, I was an instructor for surgical technology for 3.5 years. I became a master instructor while I was in the Navy. I taught a wealth of different courses, and we have a tactical combat class. I was a BLS instructor, freaking pre-hospital life support instructor, advanced burn. Like I was an instructor for everything. I'm even an instructor now for TNCC. Go figure, right? So I've been teaching for about 8 years. So I realized it's just like my ministry, my tribe, my group of individuals is the education realm, which is why I love to teach, which is why I created this. And another reason is because, like I said, I never want anybody to feel like how I felt. I don't want anybody to feel like they're a failure and like they can't do this. Like people that are not going through nursing don't understand how tough it is to get through nursing. Like first you got to open up your mouth and say, I want to be a nurse. Then you got to go through the process of doing the prerequisites, then the process of applying for school, then the stress of getting into school. Then you're so excited. Then you go through the craziness of school, how fast the curriculum goes, the exams. If you fail, do it again. Then they try to kick you out. And then the exit exams all the way through school, clinicals, whatever you got to go through with your family. Like it goes on. And then at the end of that mountain is the NCLEX. And then it starts to be, once you pass it, and then it's the beginning of a new mountain. And that's learning how to be a nurse while you're working on the floor. You see what I'm saying? So it's just like people don't realize the endurance that you have to have in order to get here. It's just like trying to be a physician or a physician's assistant. It's just like these things take time, and people that don't go through them don't understand how long it takes for you to accomplish those goals. So give everybody that's a nurse in here, or even if you want to be a nurse, give yourself a pat on the back, because you either embarked on that journey or that journey is you about to embark on it. Trust and believe. Somebody else to do it. Same, I remember your big critical care hopes and yeah, you do remember that. I thought I wanted to do labor and delivery, fell in love with the ER right 4 years in, and I still know where I belong, and that's okay. You already know that you're gonna find your spot. There's one girl I know. She works at Aetna at doing what is it? Aetna, the healthcare insurance, and she sits at home and does data utilization. Doesn't talk to a patient, doesn't do nothing, and she's in here and doing her thing, and she's just like, I love this, and I'm just like, all right, cool. Well, there it is. You got to do it. Or you can go work at a clinic, or you can go work for a medical devices company, or you can go work on a cruise ship. You can do occupational health. You can go work for the post office. There's so many things you can do as a nurse. Any tips for the new gen? Study for it. I'm sorry. No, but seriously, tips for the new generation NCLEX, well, I would say is put yourself on a study plan. If you haven't scheduled your NCLEX, schedule it, because that holds you accountable. Do at least 85 questions a day, 85 to 150 questions a day. Read and review your questions. So if it takes you an hour to do 85 questions, you need to review your questions times 3. So you need to review them for at least 3 hours. That way you can at least absorb the content that you're trying to learn. Content. So whatever you struggle with the hardest, so if it's pharmacology, start there first. And then you go to the ones that you know better. Those are the last things that you look over. Put yourself on a schedule. When you're studying, put your phone away. Recreate the testing environment. So not everybody is going to have what I have, where I have computer here, right? But recreate the testing environment. Turn your phone off, put it on silent, go put it in another room. No drinks, no snacks, no nothing up in here. Answer or quiz up here, no nothing. Recreate the testing environment. Practice like you play, right? So it's just like if you show out at practice, then you're probably going to show out at the game, right? So if you do the things that you do in practice, if you practice poorly and then you get out to a game, you're going to perform poorly, right? I would think we would all be in agreement to that, right? So I would practice your hardest and then take that same practice into the game. I'll give you an example, and I said this on the last stream, is that I got to the point to where I sat in this chair and then I ended up sitting like this or something like this. And then when I went to go take my NCLEX, I was about at question 45 and until I realized that I had my hand like this because I was in a position of comfortability because that's how I practice. And when I took my exam, it was 60 questions. I did a video on my YouTube. You guys can go over there and check it out. Links in my bio. And it's called I Failed NCLEX, yeah. And I got into a rhythm. And then once I got into that rhythm, I was okay. 45 questions. I'm like, oh, okay. Next, 15 questions. I was done. I was out. It took me an hour and 5 minutes to do that because I had already been practicing at 75 to 150 questions a day or every other day. Because I had put myself on a schedule and I had stick to it. I had cut off everybody else. Because when you get your license, and everybody that's a nurse in here can agree with this, when you get your license, it doesn't say your first name, your last name, and friends. It doesn't say first name, last name, and family. It says your first name, your last name, RN or LPN or LVN with a license number. That's what it says. So that would be my recommendations on studying for the new generation NCLEX is that you got to, like the meat and potatoes, you got to have content. You got to have content in order to understand the questions. But then now you have to know how to critically think with the NCLEX questions. So can we be friends after NCLEX? Are you talking about me? We are friends already. What are you talking about? So who is that? Is it Yamali? Hopefully I said your name right. Hopefully that answers your question. I am not trying to be around these kids all the time, right? Did she ever work on the first floor? I don't know. Maybe. Is the NCLEX really that difficult? I will be taking it next month. The NCLEX is it's a hard test. I've never met anybody that's gone to take that exam who didn't leave like they felt defeated, even if they passed. I've never, like some people, they got to 75 questions, they were like, I know I failed. And then they passed. Because it really does test your critical thinking because you don't know if you got it right and you won't know if you got it right. So that's why it's like you have to practice. I mean, after a while of practicing, when you do go through your trends of critical thinking, you're going to know what signs and symptoms are. You're going to know what the disease processes are. You're going to know if you see lab values trending in a different direction, what the signs and symptoms are going to exhibit in your patient, right? Don't forget those things because they'll start throwing labs at you. They'll be like, hey, we need to do serial hemoglobin and hematocrit. Oh, okay. So the hemoglobin and the hemoglobin's at, we'll say 10. And then an hour later, it's at 8. And then an hour later, it's at 7. So that's telling me that my man or my lady is bleeding somewhere. And we need to figure out why. So do they need a blood transfusion? All right, cool. Let's do a blood transfusion. But then what happens when you give too much blood? Do I need to do a CT scan with contrast? Without contrast? What's the GFR look like? Do they have a kidney issue? Right? That is what critical thinking is about. Is you got to know what the disease process is, and then you have to go through the trends of of everything that's being given to you, so you can decipher an answer. And so, if you're not prepared for that, it will be difficult for you. So the thing I would say is prepare so it's less difficult for you. I'm saying your friends will be there. Yeah, your friends will be there after your NCLEX is over. Maybe. This test got me stressed. Trust me. You are not the only person to ever be stressed about taking this exam. I've not met not one nurse who have ever gone to take the exam that was just like, yeah, I'm good. Yuli, don't let this scare you. Hey, Kevin, I want to be an LPN. Some people around me are negative, saying it's hard and I should forget it. So dip 024. Those people that are telling you that it's hard and you shouldn't do it probably shouldn't be your friends. Next, we got a bleeder. We got a bleeder. That's true. Then you need to surround yourself around better people. Yep, you got this, Nurse Nelly. I'm trying. I don't know exactly what to study and where to go. or where to go to study. I want to push it back. Look, I'm always telling people, if you want to push it back, you can do that. But when you push it back, you still deny the inevitable. At some point, you're going to have to take that exam. You could always check out my review or my course right now. It's in the pre-launch phase. The link is in my bio, but it's not complete. So if you're taking your exam within the next couple of months, probably won't be ready for you. Ones I could suggest would be Archer. They have Archer, Simple Nursing. They have Remar Nursing. They have Kaplan, UWorld. It all just depends. Our professors always said ABCs. Is that useful for NCLEX, or am I just nervous about the NCLEX? It all just depends on what is presented. What's more important? Is it a level of conscious issue, or is it breathing, or is it airway? It all just depends. Does it require you to do further assessment? So here's one. If I give you two patients, one who's having a level of conscious change or somebody who is massively hemorrhaging, which one of them would die first? I took my test yesterday. Was that Jaden Navarro? Hey, you got this, Jaden. Hey, when we do another live, I want you to come back over here, Jaden. First of all, Jaden, you better follow me right now, and you better smash that like button and give me the 4,000 likes right now, Jaden. Okay. And then I want you to follow me. And then when you get your results, when we do another live, make sure you hit that notification button. And I want you to come in here and I want you to let us all know that you passed. Yep, go for it. You got it. I just graduated. I love Simple Nursing. Simple Nursing's YouTube channel. I love his YouTube channel. That's it. Which would die from first? Yep. I can't remember nothing. Well, it's not about necessarily remembering. It's more about being familiar. So it's just like, I don't expect for you to know every disease process, but I do expect for you to know what everyone else knows, right? You need to know what signs and symptoms look like if I give you lithium toxicity. Everybody needs to know that, right? It's all about being a safe nurse. Point blank, period. That's what the NCLEX is for. That's what it's for. That's how it's used, right? So appreciate everybody for being in here. Got 31 people. Hey, if you're just now joining, my name is Kevin. I like to go through this spiel every so often in case we get some new folks up in here. But I go by the Boot Nurse. I'm the Boot Nurse on every social media platform. Check them all out. I got Thread now. I guess that's cool. Twitter, the good old twits. Of course, Instagram, YouTube, Facebook as well. Also have a NCLEX course right now. It's 80% off, going for $48. It's in the pre-launch phase, so anybody that gets it right now will get it 80% off, as well as you will get it for a lifetime. So if you're one of those people that's starting nursing school within the next semester or whatever, by the time you graduate, it'll all be there. And it's a work in progress, so get it while it's hot. Being safe. One last question. Is the NCLEX like nursing exams where this is like 4 answers, A, B, C, and D? Some are. Some aren't. I'm actually going to be doing, and this is actually one of the lectures that I said I was going to be doing, and it was talking about the NCLEX test plan, and it's talking about the different types of NCLEX question types. So your exam is going to be select all that apply, extended multiplication, case studies, click and drag, the Dropbox, highlight. Like there's going to be a lot of them that are going to be in there. So Aaron, to answer your question, no, it's not just going to be 4 answers, A, B, C, and D. Like your extended multiple choice are going to be probably, I think it's at least like 6. But the good thing about the NCLEX now is that it's they have partial credit. So if you get one of those that's like select all that apply, it will start to grade you based off of the ones that you got right. So, but let's just say you got one wrong. It'll do like 0.1, point whatever. So if there were 3 answers, but you answered 4, it would give you 0.1 for the one that you got, the 0.1s for the one that you got correct. So that will give you 0.3. But then if you answered one wrong, it would take it down 1, so you get 0.2. Does that make sense? Hope that makes sense. I'm glad I took the NCLEX before all the new changes came about. Honestly, me personally, and it's only because hindsight's 2020, I would have done way better at this exam. Just for the simple fact that I'm like, oh, that's what you're asking. Oh, let me see what the trends look like. Oh, okay. Based off of this, we got a bleeder, right? So yeah. But the standards for the NCLEX are still the same. They're not going to change. They're not going to change. And the NCLEX actually said that. They were like, can y'all make it easier? And the board was just like, no. So I love the new gen questions, especially partial credit in the case studies. The case studies, they literally can give you one case study and they can ask you 6 questions out of that one case study. It's kind of like a runoff type of thing. I can ask you 6 questions or I'm sorry, give you 6 answer choices or whatever with one big case study. I literally didn't know anything upon graduation, I promise. No, it's okay. Me neither. We never do. It's like when you take the NCLEX, you're like, yes, thank God I got my license. And now you go work at the hospital. Now you're even more damn terrified when you're working over there. So select all that apply will be the death of me. You and everyone else. Let me tell you, select all that apply, honestly, is all about knowing what certain things are. So I like to use this one as an example. So when it comes to select all that apply and delegation, like who can do what, right? What can the RN do? What can the LPN do? And what can the UAP do? If I give you a select all that apply, I'm the nurse, blah, 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 blah. What tasks do I assign to the UAP? At this point, you need to know what can the UAP do. Like they can collect urine. They can do activities of daily living. They can do vital signs. They can do ointments. They're not asking, hey, do you have your shot certification? LPNs, they're not asking you if you have IV certificate. They're not asking all that. Because NCLEX, they don't care. Because remember, it's standardized. As an LPN, you're not standardized to do those specific things according to the board. Not Kevin, because if you can do an IV, Kevin can do an IV. But if I don't got to do it, I won't do it. I'm past that point to where I enjoy doing IVs. I'm just like, all right, cool. We just got to get a line in this person. You know what I mean? I should have been a PIC nurse. Hey, think about that. Hey, PIC nurse, all they do is just give PICs all day. I'm just saying. 2 lines, 3 lines, single lines, whatever. Dropping TP in. I'm just saying, PIC lines are great. But with SATA, I think true or false. Yeah, like, hey, can they perform this task? Yes or no? No? Okay. And here's the thing. It's just like, if you don't know, don't pick it. Like, if you can't 100% tell me that this answer is what the question is asking, don't pick it. Like, you'll be like, oh, what I think. Don't pick it then, because you're not sure. Better for you to live by that type of mantra than you just be sitting there going back and forth like, I don't know, maybe so. You know what I mean? My program isn't teaching us the new NCLEX, so we have no clue what it's about. That's why I'm so terrified. And you have perfect reason to feel that way, and it's very justified. So the one thing I would say is to, one, come to these lives because we'll talk about them. I'm also going to be bringing up some other things, talking about NCLEX style questions. I do have a lecture that I'm actually going to be recording either today or tomorrow when talking about the new generation NCLEX as well as the NCLEX standard, because that is huge. Like, people are they don't know anything about that. And that's just wild to me that the program the curriculum for the NCLEX changed, but your school didn't adapt to that. I think that's actually piss poor on your school. They better be fucking accredited pulling some nonsense like that. So no hashtag fake nurses around here. So, but yeah, that your feelings are valid with that, Aaron. So what I would say is to, you could definitely look on, I think like Archer, they have some good stuff. Simple Nursing, they have good stuff. Remar, Kaplan, those are usually the ones I recommend to people. So if you're looking at a review that's already complete and done, I would look at them. Like I said, I don't shit on reviews. Like, I've used all of them and I thought they were okay. But I loved Kaplan, but Kaplan is probably way out of people's price ranges, which is fine. But it's definitely helpful. So scour the internet, follow people that are talking about this to actually help ease your anxiety about it a little bit. Okay. So, but yeah, I'm not going to hang out here too much longer. Like yesterday or the day before, I was up here for 2 hours and your boy got some stuff to do. Who is that? Is that Venti? Hey, shout out. Thanks for the roses. I appreciate that. I think that's like 63 cents or something like that. I don't even know. I don't ever get roses like that. So that actually makes me another rose. Hey, shout out to you. Oh my God. That's crazy. I never get roses before. That's nice. I appreciate it. Thank you. You gave me another one? Oh my God. All right, stop. You're about to make me blush out here. I'm black as shit, so I'm blushing, I'm looking all crazy. But Mark Clemick's lectures help me pass. Hey, so if you can find Mark Clemick's lectures on YouTube or anything, they hold their weight in gold. They're outdated very much. Like, they came out like in 2008. However, it's still about 90% accurate. And I love Mark Clemick. Our director said they can't change it because we graduate in about 21 days. It's so discouraging. We'll continue to come to your lives. Thanks a lot. You're very welcome. Also, follow me on all those other platforms as well, because I'm mostly active on Instagram for sure, where I start dropping stuff and I talk about stuff. So definitely follow me on Instagram. And of course, if anybody ever has any questions about anything, I have no problem answering them if I see them. So don't be discouraged. Don't let this career field beat you up before you even start. And even if it does, fight back. We don't play that game. We don't just get pushed into a corner and then get beat up like that. So, but at this point, I'm going to call it quits for the night. Next live will be on Friday, and it'll probably be around the same time, probably about 5:30 ish. So, if anybody has any questions before then, you guys know where to find me. If you guys know anybody that needs the NCLEX review or anything like that, go ahead and check out the 7-day NCLEX course. Link is in my bio. And like I said, it's 80% off right now. And you get it for a lifetime. So, bye! Shout out to Nurse Nelly. Y'all go follow her. She's good people. But yeah, I will see you guys on Friday. Peace. I'm going to go yell at my son for being 15 months. All right, bye.